Showing this and every Wednesday at 4 p.m. on Vibetown Media.
Good evening, viewers. Welcome once again to your favorite health show, Health Zone on Vibetown Multimedia. This evening we have a special guest. He is in the person of Dr. Nelson Ahadome. He is a physiotherapist, public health scientist, an author, and a mental health advocate. Our topic for discussion is stroke and its effect on mental health. Welcome, Dr. Nelson.
Thank you very much.
Okay. So tell us, what is stroke? People say stroke, stroke, stroke. We want to know what stroke actually is.
Okay. Thank you very much, Rabi, for the opportunity. And thank you, Vibetown Media for having me here. Actually, when we talk about stroke, it's a multifaceted issue. We have to look at it from different angles. Stroke happens when there is a shortage of blood supply to the brain, and this leads to the death of the neurons of the brain. So it could happen either through occlusion, that's ischemic, when the brain is not getting blood supply due to, closure in the blood vessels. It could also happen when the blood vessels burst due to pressure of the blood. So stroke can happen either way, and this can lead to a lot of symptoms. Now, when stroke happens due to either ischemic stroke or hemorrhagic stroke, which is from the blood pressure, it will lead to dysfunction of the body. This is because the neurons or the nerves that form up the brain control the movement and every activity, every function of the body. So when they are damaged, the things that they control can no longer be controlled the way they have to be controlled. So we have the stroke affecting one side or both sides or upper part of the body or lower part of the body, depending on the neurons that are damaged.
Okay, thank you very much, Dr. Nelson. But we would like to know, are there any specific causes, some things around us, what we do in our systems that causes stroke?
Okay. When we look at the causes of stroke, it starts from the genetic angle, and then that's when we look at the genetic exposures, the risk factors that exposes one to having a stroke. If it's in your family, you are likely to, also develop it. Okay. If your lifestyle exposes you, to such a condition, then it's also possible that through acquiring high blood pressure, diabetes, or other issues of cholesterol, atherosclerosis, or coronary heart disease, then it's possible that you could also develop a stroke or stroke-related conditions.
Okay, so you said something very important about genetics. So if I get it right, if perhaps you have relatives who have suffered it in the past, or maybe your parents have it, you are also predisposed to it?
Yeah. If there is history of high blood pressure in your family, then it's possible that you can develop stroke. So it's not just the stroke itself. Maybe in your family, nobody has had stroke before. But there is history of high blood pressure, high cholesterol level in the family. Then it's possible that you could develop a stroke if you don't, if your health is not checked.
Oh, okay.
Yes.
Okay, that's clear enough. Can you tell us some of the impending signs and symptoms of stroke? Maybe I'm at home. I'm hypertensive, or I have hypertension already. What are some of the things that will happen to me that will make me think I may be suffering from a stroke, or suffering a stroke, or a stroke is about to hit me?
Okay. Stroke doesn't just happen. It happens over a period of time. There are signs and symptoms. There are warning signs. There are actually sometimes moderate or minor attacks that will even give you a highlight of what is about to hit you. Okay, so at some point when you feel that your blood pressure is going above 160/90, then you should know that something is happening. In fact, for a healthy blood pressure, now we are looking at, from WHO, we have reviewed the records as 130/85 for a healthy blood pressure. So any blood pressure above 130/85 means that it's quite high, but that doesn't predispose you to stroke if you don't have diabetes. So for people with diabetes, their likelihood of developing a stroke is higher, and that means that they can have stroke or other attacks at even blood pressures which are not so high. So for people with diabetes, it is important that you work on your blood pressure for it to be lower, for it to be around the 120/80, which is healthy, or at least 130 and below. So for the pending signs, again, we can look at what we call transient ischemic attack. Okay. Now, this is a sign that you are about to have a stroke. It's a minor stroke. It happens when one part of your body is not functioning as it has to. So you are not able to lift your hand from maybe your left hand. You are not able to lift your left hand. Your right hand is your right leg is not able to go up. I mean, it depends on which side the stroke wants to happen. So when you realize that there is disparity or differences in how you raise your hand, there is heaviness on one side of your body, there is loss of sensation in one part of your body, this could all be a sign that something bigger is about to happen.
Danger signs.
Yes. And when the stroke itself happens, then that means there is going to be complete loss of function on the side that is affected. So if the left part of the brain is affected, the right side of the body suffers. And this means that when the stroke itself happens, then that means that you are not going to be able to raise the affected part the way you used to. You can raise both hands, but you realize that one is not going up. So you raise like this, and you put all the energy in trying to raise the other one, but it doesn't go up. Then it means that a stroke has happened. If this resolves within 24 hours, it means it's not a miracle, but it's a transient ischemic attack. Most people experience TIAs, and they feel that they've recovered from stroke. No, you have not recovered from a stroke. You are rather recovering from a transient ischemic attack, which is a TIA. Within a week, usually the symptoms go. If you go to the herbalist and other people and they tell you that they solved it, it's not them. This is how that one is. It's just a short episode of expression of dysfunction. Now, if you don't manage the TIA and stroke itself happens, that is where you become, more difficult to recover. And at this point, when you go to even those herbalists that you think that they can do anything,
they may not be able to help.
No, you wouldn't be able
If
to
you
get
just
any
joined
results.
us, we have Dr. Nelson Ahadome in the house. He's a physiotherapist, public health specialist, an author, and mental health advocate. We are discussing stroke and its effects on mental health. So we continue from there. So what should we do when we notice such a situation, when such a situation arises? What do you advise the individual to do at the moment the person sees those signs?
Okay, for me, as a public health scientist, I usually tell people that don't wait until something happens. Yes, and through one of my organizations, the Icon Health System, we try to write a health book on blood pressure and managing your heart conditions, which is an aid to resilient health. You see, it's better to get information. It's better to get yourself informed. It's better to live a healthy lifestyle and to check your health and prevent all sort of conditions from happening. Because stroke and its related conditions do not easily resolve. Some can even lead to death. It can lead to disability. It can lead to body dysfunctions. It can lead to mental health issues. It can lead to so many things. So why don't we, take care of ourselves now to prevent ourselves from, suffering in the future? Yeah. These days, many people, abuse so many things when it comes to their eating. They eat so much spices. We eat so many things that increase our blood pressure. And we drink so much too. We can control all this in order to be able to stay healthy and prevent, causing our family and ourselves bigger problems in the future. So my advice is, let's stay healthy, let's check our health, and let's monitor our vitals well so that we can prevent stroke.
Thank you very much, Dr. Nelson. You mentioned mental health along the line, and it seems to be the other aspect of what we are treating now, because we are treating stroke related to mental health. So please tell us, how does stroke affect mental health?
Okay, thank you. Stroke actually has a lot of pressure on both the individual and the family. You can see someone so active today, very active, very strong, going about their lifestyle, their businesses and everything. But when a stroke happens and this person becomes immobilized, as in bedridden, you see, that's pressure of being bedridden alone is not easy for this person's mental well-being. The demands, the economic crisis, the social pressures that are on you, and you yourself, the expectations that you have for yourself as a human being becomes, disturbed. So a stroke can, in two ways, affect the mental well-being of a person. One, as I described from the beginning, stroke happens when there is a damage to a part of the brain. So when there is a damage, that leads to abnormalities in the brain that affects the reasoning and the speech and the functions of the brain. Then this person could have a mental breakdown. That is from the physiological angle. Then from the psychological and then the social angle, when this person is no more able to do the things that they used to do, when they are not able to make money, they are not able to look after the people they want to look after, they are not able to relate with their friends and go out about their jobs and travel and all these things because they are bedridden, it takes a toll on their mental well-being. Now, the families responsible for people living with stroke also go through a lot of dilemma. I have had a chance to treat more than 1,000 people with stroke in my practice.
Wow.
Over the period of 10 years.
Nice.
So relating with families and, families from across the regions, I've realized that it is not easy for the families. In fact, sometimes they have to make contribution just to be able to get medical care for the individuals who are suffering from these problems. Families have to make themselves available. It's like you are having a baby
to take care of.
Now, this time, not just any kind, not a 2-year-old baby.
An adult baby.
This is like a baby who is just 2 days old. because the baby cannot do anything. Even 2-year-old babies, they can move about and do their things, and you can instruct them.
Understand where the problem will come from.
Yes, in this case, the person is not able to do so many things for themselves. You need to be there for them, and you need to receive treatment for them. Without the right treatment, they are not able to recover at all for many years. So it's a big issue for the individual and for their families.
Nelson, is it possible to regain full body function after suffering a stroke? I mean, to come back to using your limbs and all affected sides?
Through my practice as a physiotherapist, we try our best to ensure that one is able to regain functions again. And we do this through treatments that are targeted at improving the recovery in the brain and improving the muscle function in the body. As I described earlier, the problem is with the brain, but it affects the whole body. So with time, if you are not receiving the right type of treatment, the joints of the body begin to lock. Then without proper treatment, your chest, your lungs, they all close up. Your heart becomes weaker. Blood circulation, everything becomes poor. Within a few years, this person will die without the right treatment. But with the right treatment, I have seen and I've witnessed and been part of many treatments to see that, yes, you can regain functions. Now, what I usually tell my patients is that when your stroke happens and you start treatment with me or with a good treatment protocol early, you are able to regain your functions earlier. But when you start too late, it takes a longer time to recover. So yes, you can recover from stroke, it's possible, but it depends on the approach. If you go and sit in some herbal home and the poor herbs on you,
I wanted to ask you because there's a myth out there that stroke is not hospital sickness. They say it was a stroke and you're hospital area. Stroke is not hospital sickness. You're treating stroke in a hospital. What do you have to say about that? So now you can tell us.
Okay.
Tell them they are watching.
Okay, thank you for watching and thank you for this question because it's always at my heart. In fact, I've worked from Volta region, Central region, Eastern region, and now in Accra. So I've seen a lot through all these regions. So one experience I used to always share is that people would say stroke is not hospital yari, but it is hospital yari. People would think that, oh, because stroke is not treated with medication, it is, no. In the hospital, we have so many professions in the hospital arena. That's why we call it multidisciplinary community. And that is what I am very passionate about, promoting a multidisciplinary approach, okay, to every condition, but especially stroke. With stroke, you cannot solve it just by taking medication, no. You cannot go, there is no medicine out there where you go and take, oh, okay, my stroke, and see me far away, then my stroke will go. No. You can take medication. In fact, there are medications to prevent a second stroke from happening, which is the blood pressure related medications, the brain growth medications, and then all other medications that will help to prevent diabetes and cholesterol from building up. These are important. But the incident of the stroke itself, that weakness, that difficulty you are having to, overcome, that cannot be solved by medication or by any herbs. And this is very important to understand. No medication or herbs can just quickly get you up to start running again. This part is reserved for physical therapy. Without the right physical therapy, without the right approach to recovery, with the exercises that you have to do, with the treatment that the physio have to give you, with the blood circulation that the physio has to improve, with the muscle training, the brain development programs that the physio and the occupational therapists have to give you. Without these things, your recovery from stroke will be limited. Naturally, the body recovers from stroke. So what the physio does is that we try to make sure that this pattern of recovery is well done, such that the person doesn't become, is it auto-leg or, your hand will bend this way and you'll be walking in a certain way.
Okay, so Doc, what advice would you give to people who are suffering from stroke now? Right now.
Okay. First of all, it has happened already. Second of all, prevention is better than, waiting for another episode. So I would advise you and the family to seek for treatment and also, seek for medical care to prevent another episode of stroke from happening. Now, to recover from stroke is a gradual process. Gradual said that you shouldn't rush yourself. The condition is terrible, but you, the person, you must keep encouraging yourself. In fact, the whole family must keep encouraging themselves and each other and the patient involved, so that together we can recover. And I'll advise you, let's not be spending too much money on herbs and other things looking for solutions. Let's seek the right solutions by, receiving physical therapy to, recover functions, to regain again. Now, with the families, we know that it's not easy to take care of someone in this condition, but we are all together. Anyone at all can, go through this. So let's have patience for them. Let's, support them. In fact, there were times that these same people used to support us. So at this point that they are going through this challenge, let's support them so that they can recover. I've had a chance to, treat some families and couples, and sometimes, one person wants to leave the other because of stroke. I think that this is not very good for people to separate and leave their husbands or wives because they are suffering from stroke. Let us, this is the point they need your care more. And this is where the for better, for worse comes in. Okay, show more love to them, support them, and this could be your God-given responsibility. Thank you very much.
Well, viewers, this is where we draw down the curtains on today's episode. Join us same time next week, 4 p.m. VibeTown Media. Bye.
Showing this and every Wednesday at 4 p.m. on VibeTown Media.